All right, so let's run through some critical care questions. True or false? It is the goal of the pre-op evaluation to provide the patient with medical clearance in order to undergo a surgical procedure. False. The purpose of pre-op evaluation is to evaluate the patient's current medical status, not to provide medical clearance. So the pre-op eval is for medical status, not medical clearance. Preoperative management of the diabetic patient consists of what? Pre-op management of a diabetic patient consists of what? Oral diabetic agents should be discontinued by 1 day prior to the elective procedure. The patient should be NPO by midnight, such as with every other patient. Third, the insulin-dependent diabetic patients should be given 1/2 of their normal dose of insulin in the morning of the surgery. This is because surgery itself will cause an increase in blood sugar. Lastly, always check their blood sugar prior to any surgery, always. So to review, oral diabetic agents should be discontinued 1 day prior to an elective procedure. They should be NPO at midnight. Insulin-dependent diabetics should be given 1/2 of their normal dose of insulin on the morning of the surgery, and always check their blood sugar prior to said surgery. Why are low molecular weight heparin or unfractionated heparin preferred for bridging off warfarin compared to other agents? Other newer agents, such as direct thrombin inhibitors or direct factor Xa inhibitors, lack a specific reversal agent. Thus, heparin is preferred due to its ease in reversal. Name the aspects of an operative note. Name certain aspects seen in an operative note. The mnemonic is going to be triple P safe disc, so pre-op diagnosis, post-op diagnosis, procedure, and then you have safe, surgeon, anesthesia, fluids, estimated blood loss. Last is disc, drains, IV fluids, specimen, and complications. What are 3 potential causes for short and shallow breathing? 3 potential causes for short and shallow breathing: increased pain, premature extubation, and pneumothorax. Post-op hypotension or tachycardia should always be assumed to be what until proven otherwise? Post-op hypotension or tachycardia should always be assumed to be what until proven otherwise? Hemorrhage. What are 2 common causes of post-op tachycardia? What are 2 common causes of post-op tachycardia? Hypovolemia and inadequate pain control. What device allows for an estimation of intravascular volume, and what is this measurement called? The device is a pulmonary artery catheter, commonly known as a Swan-Ganz catheter. This measurement is known as pulmonary capillary wedge pressure. How can you determine the cause of post-op oliguria? How can you determine the cause of post-op oliguria? This is accomplished by calculating the fractional excretion of sodium value, or FeNA. If an FeNA is less than 1%, that equals pre-renal azotemia. So fractional excretion of sodium is low, which means you're maintaining more sodium, which is the correct accomplishment due to a low volume state. You want to maintain sodium and maintain fluid. A fractional excretion sodium greater than 1% is due to intrinsic renal parenchymal dysfunction, such as acute tubular necrosis. This is because you're unable to maintain sodium, thus you're inappropriately releasing sodium into the urine. How do you calculate the fractional excretion of sodium? How do you calculate the fractional excretion of sodium? What is the formula is what I'm asking. It's going to be the urine sodium times the serum sodium over the urine creatinine times the serum sodium. And you want a percentage, so it's going to be times 100. When must you begin enteral feedings post-operatively? When must you begin enteral feedings post-op? If the patient is still NPO after approximately 5 days. With regards to nutritional support, how do you calculate the patient's basic energy requirement? This is accomplished via the Harris-Benedict equation. This calculates the amount of protein, lipid, and carbohydrate replacement needed. How do you calculate this Harris-Benedict equation? How do you calculate the Harris-Benedict equation? So it's going to vary based on men or female. For men, it's going to be your basic metabolic rate equals 66 plus 13.7 times the weight in kilos plus 5 times the height in centimeters minus 6.8 times the age in years. For women, it's going to be BMR equals 655 plus 9.6 times the weight in kilos plus 1.8 times the height in centimeters minus 4.7 times the age in years. Yeah, I'm probably not memorizing that. Explain the difference between TPN and PPN. Explain the difference between TPN and PPN. TPN, or total parenteral nutrition, is administered through a central venous catheter and is used when a patient requires extended periods of intensive nutritional support. Patients on TPN cannot tolerate oral or enteral nutrition. In contrast, PPN, or partial parenteral nutrition, can be administered through a peripheral IV catheter. This modality is reserved for patients who can tolerate some oral feedings, but cannot ingest adequate amounts of food in order to meet their nutritional needs. So PPN is for patients who can tolerate some oral feedings, but cannot ingest adequate amounts of food in order to meet their nutritional needs. How often should a diabetic patient have their blood glucose checked postoperatively? How often should a diabetic patient have their blood glucose checked postoperatively? Diabetics require that their blood glucose be checked immediately upon their arrival at the post-anesthesia care unit, or PACU, and then every subsequent 6 hours thereafter. An insulin sliding scale is used post-op, and then all IV fluids need to contain glucose until the patient is PO. When are stress dose steroids appropriate? When is it appropriate to use stress dose steroids? What type of documentation is required as soon as the patient is brought into the room post-operatively? They require a post-op progress note that is written in a SOAP format. What represents the earliest sign of inadequate organ perfusion? The earliest sign of inadequate organ perfusion is oliguria. Before treating medically for oliguria, what should always be checked for? Always check the patency of Foley catheter. This can be accomplished by irrigating the catheter with normal saline. Oliguria in the absence of pre- or post-renal causes implies what? Oliguria in the absence of pre- or post-renal causes implies what? Acute renal failure due to an underlying renal condition. Acute renal failure due to an underlying renal condition. An SaO2 of 95% or more correlates with a PaO2 of what? An SaO2 of 95% or more correlates with a PaO2 of what? 80 to 100 millimeters of mercury. Both of these values should be maintained at a value of PaO2 greater than 70 and SaO2 greater than 90. What are the components of an ABG? What are the components of an ABG? The components of an ABG consist of pH, PaCO2, PaO2, HCO3, oxygen saturation, and base excess. Describe tracheotomy from tracheostomy. Compare and contrast tracheotomy from tracheostomy. Tracheotomy refers to the actual procedure, so otomy, procedure. Tracheostomy refers to the opening itself. Tracheostomy refers to the opening itself. What are 4 reasons for tracheostomy placement? What are 4 reasons for tracheostomy placement? Prolonged mechanical ventilation. It can be indicated due to perioperative. It can be indicated perioperatively during radical cancer ablation due to potential stenosis of the trachea. It's also indicated due to acute airway obstruction as well as chronic aspiration. What nerve is at risk during tracheostomy procedure? What nerve is at risk during tracheostomy procedure? The recurrent laryngeal nerve. What is an example of extrapulmonary conditions that can lead to hypoxia? What is an example of extrapulmonary conditions that can lead to hypoxia? This is anything that limits ventilation without altering oxygen transfer. Examples include narcotics, drug overdose, or a depressed mental status. What is an example of intrapulmonary complications leading to hypoxia? What is an example of intrapulmonary complications leading to hypoxia? This is anything that limits oxygen exchange. Examples include atelectasis, aspiration, ARDS, pneumonia, pulmonary edema, or pulmonary embolus. Patients who undergo procedures in what position are more prone to DVT or pulmonary embolus? Lithotomy position. Patients who undergo procedures in a lithotomy position are more prone to DVT or pulmonary embolus. Name 3 possible treatments for atelectasis, lobar collapse, or aspiration pneumonia. Name 3 possible treatments for atelectasis, lobar collapse, or aspiration pneumonia. Several treatments include incentive spirometry, a pulmonary toilet, also known as chest physiotherapy, nasal tracheal suctioning, early mobilization, as well as stimulation of coughing. When is an IVC filter indicated for the use of pulmonary embolus? An IVC filter is used when patients have contraindications to anticoagulant use or who have had multiple pulmonary embolus while on adequate anticoagulation. That's all I have. Hope it was helpful.